light bleeding, mild pain, and a positive pregnancy test. These sound like typical early pregnancy signs, right? But what if I told you that sometimes these same signs could point to a life-threatening condition called an ectopic pregnancy? This is a medical emergency that many women don't recognize until it's too late. In this video, I'll break down exactly what an ectopic pregnancy is, its critical early warning signs, and when you absolutely need to go to the hospital. So, what is an ectopic pregnancy? It's when a fertilized egg implants and starts to grow outside the uterus, most often inside one of the fallopian tubes. The problem is, a fallopian tube is tiny and can't stretch like the uterus. This means the pregnancy can't survive, and worse, the tube can rupture, causing severe internal bleeding. This is why spotting it early is so incredibly important. If it's left untreated, a ruptured ectopic pregnancy can lead to massive blood loss, shock, and can even be fatal. I'm not saying this to scare you, but to empower you to act fast. Now for the most important part, the early warning signs you must not ignore. At first, it might feel just like a normal pregnancy with a missed period and a positive test. You might also have light vaginal bleeding, which is easy to mistake for normal spotting. You might feel some one-sided lower abdominal pain. But if the symptoms progress, you might experience a sharp, stabbing pain on one side of your abdomen, shoulder pain, which is a sign of internal bleeding, or sudden dizziness and fainting. A key difference is that the pain is usually on one side, not in the center. So, who is at higher risk? You might have a higher chance if you've had a previous ectopic pregnancy, a history of pelvic inflammatory disease, tubal surgery, or if you conceive through IVF. Smoking and getting pregnant while using an IUD also increase the risk. But here's the thing, an ectopic pregnancy can happen to anyone, even without any risk factors. How do doctors figure it out? They use a combination of blood tests to check your pregnancy hormone levels, or HCG, and a transvaginal ultrasound. If your HCG levels are rising but the ultrasound shows no pregnancy inside the uterus, an ectopic pregnancy is strongly suspected. Treatment really depends on how early it's caught. If detected soon enough, it can sometimes be treated with medication. Otherwise, surgery is needed. Early diagnosis can often save the fallopian tube and protect your future fertility. And that brings us to the big question. Can you have a healthy pregnancy after an ectopic one? The answer is absolutely yes. Many women go on to have successful pregnancies. It's a setback, not a final stop. Just be sure to get early medical follow-up with your next pregnancy. So please remember, if you're newly pregnant and experience any one-sided pain, bleeding, or dizziness, don't brush it off. Trust your gut. Acting quickly can save your health, your fertility, and your life. Please share this video with someone you care about. It could make all the difference. Thanks for watching.